Organizational design is a guided process for integrating people, information, and technology within an organization. But where do you begin? And what if this process breaks somewhere? Well, a key element of organizational design is confronting challenges and finding opportunities within the organization. We, Team Hazel, have been tasked to identify a challenge within a local organization of our choice and conduct a live case analysis to address the challenge. This process included thorough research on the organization we chose, industry research for our respective organization's industry, live interviews with organizational employees, analysis and application of pertinent organizational theory, and solid recommendations on how organizational members can proceed to address the challenge. What is our challenge, you ask? I see I've piqued your interest. Before we continue further, let's introduce ourselves, and we will tell you what we've taken away in general from this project. Hi, my name is Perrin, and I will be one of your narrators for this video. This project was very valuable experience because the analysis approach practice is applicable in almost any organization.
Hi, my name is Abhishek Ghoshal. What I find interesting about the project is, firstly, this is a real problem that we are analyzing, and secondly, it's in healthcare, which is one of the fields I'm interested in.
Hi, my name is Bakaya. What I found interesting about the project is how to distinguish challenges from problems of an organization, and also how to change organizational structure to better solve the problems.
Hi, my name is Niranjan Sose. What I find interesting about the project is this project focuses on not only on the process which has been implemented at the organization, but also its impact on the regular employees, pros and cons of the implemented process, employees' feedback, and the innovative alternate solution which they came up with.
I'm Ram Kumar. I work for Cisco in the evening MBA program. I'm curious about this project because every company faces dealing with mundane tasks in the face of urgent customer issues. I'm curious how Hazel Hawkins handles it.
Great perspective, team. So on to our site. We, Team Hazel, were given an opportunity to analyze an organizational challenge at Hazel Hawkins Hospital in Hollister, California. Team Hazel has been consulted to examine a nursing unit's current quality care assessment process and propose structural and organizational recommendations in order to improve the process. Hazel Hawkins has been serving San Benito County community since 1907. The hospital provides comprehensive health care for the community, which includes emergency department, laboratory services, radiology services, medical surgical unit, skilled nursing facilities, palliative care, and nutrition services. Hazel Hawkins serves a large population of Medicare and Medi-Cal patients, thus making the hospital extremely reliant on state and federal funding. Like most nonprofit organizations, Hazel Hawkins funding is linked to its performance. Hazel Hawkins' performance is measured through its core measures. Core measures monitor the hospital's quality of care through best practice treatment plans. These treatments are widely accepted within the scientific community to reduce complications, prevent reoccurrences, and scale to treat the majority of patients. One example of an illness in which core measures track treatment is flu. It makes sense that in treating flu viruses, treatment plans should be best in class to prevent reoccurrences and complications. Also, they should be general enough to address most flu patients who are admitted into the hospital. Within Hazel Hawkins, the medical surgical or med-surg unit employs core measures to assess the quality of care the unit provides. To facilitate the process, they utilize chart audits to document a patient's plan of care against state medical standards. Within the med-surg unit, the chart audit is a printed form that the nurse populates. Due to budget constraints, it is not currently feasible to digitize this form in the short term. When patients are admitted to med-surg, a nurse enters their relevant medical information into the electronic medical record system, or EMR. During rounds, the patient's information is again updated in the EMR by a nurse. For example, a patient was given his appropriate meds and now his fever has subsided. This should be noted. However, by the end of a nurse's shift, chart audits must be generated on each patient to ensure that the state's core measures have been addressed in charting. For example, a nurse must inquire or confirm through prior documentation a patient's flu vaccination status regardless of the patient's illness. Remember, we identified flu vaccinations as a standard core measure earlier. So in summary, every day a patient is in the med-surg unit, a chart audit must be updated for that patient on each nursing shift.
Due to the sheer number of patients that come through the med-surg unit, the audit chart process can be taxing to say the least. As we mentioned, a nurse must verify core measure compliance for every patient before her shift ends. This process can be very repetitive. Additionally, overlapping patient information may already have been recorded in the patient's EMR, which is the document of record for the patient's care. The fact that the chart audit is a paper form doesn't help the process either. Lastly, there is a lot of ambiguity around the process because the nurses cannot directly see the benefit that the chart audit process has on their patients or the hospital. We sought out answers, and who better to ask than the nurses doing the process? We interviewed 4 nurses within the med-surg unit and asked them various questions in order to get a better understanding of the departmental culture, processes, and structural makeup. We asked 7 questions which were standard across all 4 nurses being interviewed. One of our goals was to elicit as much description as possible. The nursing team we worked with is currently struggling with the chart audit process, and we are more than happy to have an outside perspective. After analyzing our collective interview data, we found several key points that address the challenge and provide support to our preliminary recommendations. We are looking at 2 types of recommendations, short-term and long-term. Regarding the short-term action, we feel it is essential for management to develop an electronic chart audit development timeline. Secondly, we feel it is also important for the nurses to create and utilize an interim paper chart audit process that will minimize redundant tasks while holding them accountable to accuracy. In regards to long-term actions, we believe the electronic chart audit process should be fully implemented. Secondly, management should actively engage nursing staff in the development of the electronic solution. Lastly, significant training should be given to all medical personnel utilizing the charting system. What do you think about our preliminary recommendations? If you have any feedback, please let us know, and we will incorporate the ideas into our final report. Thank you.